That's okay.
Okay.
Sweet. We'll talk to them if they need to. Hey guys, it's Dr. Emmer. We're Saturday in West Hollywood, and I feel really honored to have such wonderful patients. My patient here today has rosacea, and like many people with rosacea, they get flushing and blushing and symptoms of pain and also dilated vessels. But we've been working very diligently on excellent skincare and doing light lasers, vascular lasers called laser genesis and Aerolase, to really remodel her deeper skin and get the sensitivity to go down, which has improved a lot. Hard for people to notice themselves, but we see her not as frequently, and we also do infrared of her skin, so we know. But what are we doing right now? Turn the music down. We are infusing a cocktail of Botox and vitamins into the upper surface of her skin. And this is not just for rejuvenation, although it does really help the fine lines, the textural issues of the skin, as well as oil if someone had really bad acne. But what this really does the most is controls the vessels and the symptoms of rosacea. And so what we're doing right now is we're using the microampule. I'll have you do Facebook. The microampule to focus on the area she gets a lot of sensitivity and sort of pain and sort of irregular flushing and blushing. And I also feel very privileged, turn a little bit, that we have a lot of patients that travel in to get the expert opinions, seeing our esthetician Candace, our nurse Reve, myself, as we create innovative protocols that really nobody else is doing. And so again, what is this? This is a microinfusion ampule. We call it ampule microinfusion, where there's little baby needles on the end to push the whatever's inside, in this case Botox and a mixture of 108 vitamins to help put nutrients into the skin. And Botox has been shown for many years, even when I was a fellow, that if you do baby injections of Botox into areas of rosacea, it literally calms the rosacea down almost instantly and can last up to 3 to 6 months, sometimes longer than that. So for patients who really need an aggressive, more treatment for rosacea, and we really want their skin to also glow and look better, we will do this microinfusion. And the microinfusion is basically, and you can see, we're literally pushing those medications directly into the skin, and with a little microchannel delivery system. And it's allowing us to get those nutrients into this upper surface. So how is this different than microneedling? Microneedling goes much, much deeper and helps for collagen remodeling. This is to actually push product into the skin, the upper surface of the skin, to get it to be brighter and more in control, like the blood vessels and such, which is what we're doing here. So her main focus really being her cheeks and chin. And so we are doing that, and once the ampule is out, we have delivered enough of the material, and that's our last phase. We just did our vascular laser treatment, and then the last step after the infusion is going to be light therapy and oxygen. So that's how you treat rosacea. You know, what I was telling her was, as she ages, her friends who don't do any of this stuff, that are developing thinner skin, rosacea, sensitivity, they're going to age much more rapidly. She is doing her due diligence and keeping it under control and really helping, and we've made major headway over the past 3 to 6 months, and I hope that in the future we're going to make even more. Have a good day, guys. Perfect. So now we can light.